Research shows the number of children diagnosed with ADHD is on the rise. Joining me this morning is Dr. Nicole Beurkens to talk about the signs and the symptoms that parents should look for at home. Welcome.
Thank you so much for having me.
So, Dr. Beurkens, how common is ADHD in children?
Well, it's becoming much more common. Almost 12% of children in the United States are diagnosed with ADHD, and that number has actually doubled in just the last 9 years. So many more children are being diagnosed with this condition.
Do we have any idea why the number of diagnoses is rising?
The research shows lots of issues. One is wider recognition of the symptoms and these challenges for children. Another is that there are many more toxins in the environment now that children are exposed to than ever before in history. Food has changed. Children, by and large, eat a less nutrient-dense diet now than they did in the past, and that contributes to brain growth and function. And everything from increased screen time, more sedentary lifestyles, changes in how schools are operating and doing academics for younger children. So the research points to lots of factors that have increased diagnosis in kids.
What are some of the signs and symptoms that parents should be looking out for?
Yeah, there's really two categories. One is more of what we think of as the inattentive or unfocused kinds of symptoms. Kids who just can't focus on anything for any length of time. They start things, they don't finish it. They may need a lot of prompting to get the motivation to get started. They're disorganized. They lose track of time. They struggle with following instructions. Their backpacks and their stuff are all over the place. So that's one set of symptoms. Then we have the more impulsive, hyperactive symptoms. These are kids who are all over the place physically, very hyperactive with their movement and behavior, can be impulsive with their decision making and their behavior. And then there are children who have both sets of symptoms, and that's called the combined type of ADHD.
Well, what are some of the ways that we can treat the disease?
Well, the most common forms of treatment are to have parents and children do behavioral therapy together, so parents learn strategies, support their children and help them through the tasks that they need help with, and also to give kids skills for how to think through things, how to organize themselves, how to manage their behavior. So that certainly is an important component. Medication can be appropriate for some children, although should not be a first-line form of treatment. And then we've got everything from monitoring of making sure kids aren't getting too much screen time, to making sure they're getting enough movement, making sure that their diet is nutrient-dense and appropriate for them. So many things that we can do to support these kids and improve their symptoms.
All right. Thank you so much for running through so much in such a short period of time.
Thank you.